On the News Channel 5 network, this is Titans Tuesday.
We welcome you in, everybody, on this Tuesday night. It is Titans Tuesday, and if you've been watching this program now for the past 4 weeks, you pretty well know what we do on Tuesday night. We have Dr. David Moore here tonight, and he is being brought to us by Baptist Sports Medicine. He's going to talk to us about orthopedic surgery and what may be going on with broken bones with the football team. We're going to talk about Vince Young. We're going to talk about his practice in general, how it may relate to you as a weekend warrior or an athlete out there on the weekend, or a high school football player, whatever it is you may do, soccer, doesn't matter. Let's say hello to Dr. David Moore. Doctor, how are you, sir?
I'm doing great. How about yourself? Are
you a fan of, and of course, our injury report tonight brought to you by Baptist Sports Medicine. Are you a Cub fan? Are you a Titan fan? You're a Predator fan? You're an MTSU fan? You're all of them, aren't you?
Absolutely. Certainly a Titans fan and a big Predators fan.
And you were the team physician for the Predators until something came along that stopped that.
I was their team physician last year, and then unfortunately Baptist and the Predators decided to end their 10-year relationship. So
sometimes business and politics gets in the way, doesn't it?
It does, unfortunately.
Yeah. So here's an interesting question for me, at least anyway, Doc. Are there any similar injuries, hockey players to football players?
We actually see a lot of very similar injuries. The rehab and the recovery actually turns out to be a lot different, just because obviously the players are doing different things. The hockey guys are balancing on a little quarter-inch skate blade, whereas the football guys are actually having to cut and pivot and plant. So we actually had a couple ACL injuries last year for the Predators, whereas obviously the Titans will have, unfortunately, 2, 3, 4 sometimes in a year.
I would say maybe the difference between the hockey players and the football players is the football players are getting pounded a lot more often on that part of the body than say I mean, I know the hockey players do too, but it's not that often, I wouldn't think. I mean, when you tackle a guy, for instance, and when you hit him with your shoulder, your helmet, or whatever the case may be, and then you're turning on grass, it doesn't give sometimes.
I think you touched on the biggest point, which is the hockey guys are playing on ice, and they're on skates, and that skate blade moves just 2 or 3 inches every time they get hit, which is just enough to kind of transmit a lot of that force. Whereas if you're playing football and your foot's planted and you get hit, or you go to change direction and your knee gives out, there's no give at all.
Let's talk about Vince Young. Vince Young, of course, the most notable injury going for the Titans right now, and that is good news. You know, we have this injury report that you guys come up and talk about every Tuesday night, but thank goodness the Titans don't have that many injuries, so we're just talking in generalities here. But let's go back to the Vince Young injury. It is a sprained knee, and that's the term that the media has kind of put out there. But explain to us again what a sprained knee is, and here we are now. He hurt that knee in the Jacksonville game. That was 4 weeks ago, so here he is almost 5 weeks into that injury. Where is he, do you think, and what's going on with that rehab?
So just by definition, a sprain is basically a partial tear to a ligament, and his, just from what I've read in the papers, is that he's partially torn his medial collateral ligament, which fortunately for him is one that's outside the knee joint and actually has a pretty good blood supply. That injury can be somewhat tricky. Some people, if it's a mild injury, can get over it in 1 to 2 weeks. From everything that I've read and heard, it sounds like his is more severe than that. 4 to 6 weeks would be a pretty good time to return, and it sounds like he may be even, from what I've read, thinking about practicing or something either later in the week or next week.
He started throwing a little bit yesterday. He probably threw some today. We'll be out there tomorrow, and we'll see what he's doing tomorrow. But he's probably throwing a little bit too. He's been running a little bit as well, so he's coming back. What is it in rehab that an injury like that? What is it you have to do more of to rehab? Is it riding a bike? Is it a treadmill? What is it?
Kind of general principles for rehabbing any injury around a joint are to first get all your motion back, because when you have an injury like he had, the first thing that happens is your body just shuts down all the muscles around your knee. So his quadriceps are going to get very weak very quickly, and it's going to hurt. It's going to be hard to get all of his motion back, so I'm sure they're working on getting all of his motion back to start with, and then gradually working on trying to get him stronger.
Can that knee come back better than it was before?
I'm not sure that anybody would ever say they're better than they were before when they have a significant injury, but that's one of those injuries that actually people recover from very well. He's obviously a quarterback that relies a lot on his legs to get around, and it may be a little tougher for him to get back as quickly as some other positions might be able to.
So for someone who's never, and I was going to say undergone the knife, but I don't know how often you guys use knives now. I mean, the scalpel is what we're talking about. So Bring us up to date on the technology of your business and what's going on in orthopedic surgery.
So there certainly have been a lot of advances in what I do, which is predominantly orthopedic sports medicine, so a lot of arthroscopic shoulder, knee, and elbow surgery. I actually think the biggest advances have been in the shoulder, to be honest with you. There are a lot of things that back even 10 or 15 years ago, we were fixing them almost exclusively through big open incisions. The technology has improved so much, we can do just about every operation that we used to have to do through an open incision arthroscopically. And that's true whether it's an instability operation for the high school football player that dislocates a shoulder, or whether it's the weekend warrior that tears a rotator cuff. So,
right, and orthoscopic is not as invasive, but it is invasive to a point.
That's true. We make little stab incisions kind of around the joint, and we use basically cameras to see all the way around on the inside of the knee and or the shoulder. We can actually see better, believe it or not, arthroscopically, because you can look from the front, from the side, from the back, and we can get places where otherwise you'd be limited just from a big open incision.
So those were kind of the ancient days when they had to use scalpels, right? I mean, you just had to go in there with a naked eye and just try to see what's going on and fix it.
The incisions are certainly a lot smaller. The principles are still the same, though. You have to have a good operation, whether it's done arthroscopically or done open. And
well, you know, Doc, I'm talking about the NFL now. You go back there and you take a look at some of the old guys. You look at their knees, man. They got scars on it that go 7 and 8 inches long.
Yeah.
You know, he blew his knee up.
I still see a few of those guys that'll come into the office. You know, once a week or so, you'll see somebody that'll come in. They're usually somewhere between 45 and maybe 70, and they've got those big incisions that you're talking about. And kind of ask them what happened, and they say, yeah, they didn't really know what they were supposed to do back then, or they told me that this was about as good as they can make it. But it's pretty hard to get over a great big incision like that and get back to being a cutting and pivoting athlete.
The people like me, or if you want to call us weekend warriors, are just people out playing softball. Okay, got a lot of softball teams, got a lot of kids doing soccer. My point is going to be this: do we get injured because we're out of shape? Do we get injured more often because we don't know what we're doing? Do we get injured because we just are careless in our body movements under some kind of pressure?
Maybe yes to all of those.
All of those, yeah.
You know, I think people that are out there that are trying to do things on the weekends, most of us don't have time during the week to stay in maybe as good a shape as we would like to, but you get out there and your mind still thinks like you're 16, 18, 25, and your body just doesn't quite respond. So I do see a lot of people that I think are trying to push things and do things that maybe they shouldn't be doing, but that's kind of why we're here also, is to try and keep people out there doing things as long as they possibly can.
How seasonal is your business? And when I say seasonal, I mean, do you see certain type injuries at one time of the year as opposed to another?
We certainly do. We're kind of right in the middle of our very busy season, just with football starting up. We've seen lots and lots of high school kids and college kids, for that matter, that have had pretty bad knee injuries and shoulder injuries. And this will be kind of the time period where we'll see a lot of those injuries coming through. We'll try and find ways to get kids through the season if we can. And then if we can safely do that, then try and fix them at the end of the season to hopefully get them ready for next year.
You know, I can tell you, if you've never had an injury, and I had a meniscus tear, and Dr. Burton Elrod, who was your partner, I think.
Yes, sir.
Repaired mine about 2 years ago, and I can tell you the rehab is the absolute worst part of it. It is just no fun, but very necessary. And when you get to the other end of it, you're very thankful for it because you feel pretty good.
And we usually tell people if you don't have the time or unwilling to do the therapy, you really shouldn't have the operation. Because it's at least 50% of it. You can have a very good operation without doing the appropriate rehab and still not get the result that you're looking for. What
I thought was going into that thing, you know, I'm around the Titans and the Predators and all these professional athletes, and when they have this, like their orthoscopic surgery, you know, Jeff Fisher will say, oh, he'll be back in 4 weeks. I thought, man, I'll be back in 4 weeks, 5 weeks, 6 max. I'll be ready to go. What I didn't remember, what I didn't think about was those guys are rehabbing 4 or 5 hours a day. I'm in there twice a week, sometimes 3 times a week, and it takes months. It took me about 3 or 4 months, really. So you got to understand that.
And you probably have a little more arthritis to your knees than some of those young kids do, I would have to imagine.
Probably so. Doctor, it's good to have you. Dr. David Moore, and been brought to us by Baptist Sports Medicine. Thank you, sir.
Thank you. I appreciate it.
We'd love to have you back.
Titans Tuesday, brought to you by Baptist Sports Medicine.
It's time to put an end to living on the sideline. With joint replacement, the experts at St. Thomas Health Services can get armchair athletes into the game.
Honey, what are you doing? Please don't do this to me.
Life isn't a spectator sport, so jump back in. Visit sths.com.